Hello. I'm Dr. Hyde. Welcome to Texas Predator Hospital. How are you feeling? Well, I had to wait for 12 hours with all the other patients. 12 hours? You've got to be joking. No. I suffered through every miserable minute. I'm absolutely certain it was 12 full hours. That's almost unbelievable. There can be only one explanation. They must have cut the paperwork processing time in half. What brings you in today? I feel awful. I've got a big headache and a terrible sore throat. I keep throwing up and I can't keep anything I eat in my stomach for long. It just goes out the other end. Sounds like an allergy to me. Are you sure, doctor? I just got back from visiting Liberia. You know, that country where everybody and his grandmother has Ebola? Nonsense. In fact, let me use my state-of-the-art diagnostic equipment to verify my diagnosis. Observe where the diagonometer that I threw at the disease determinant chart landed. You mean that dart you threw at the target? How dare you belittle our state-of-the-art equipment? I'm sorry, Dr. Hyde. It's just that I am not familiar with modern medical equipment. I understand. It's perfectly normal for untrained individuals to be skeptical of modern high-tech equipment. Notice that the Ebola area is several inches away from where the dart, diagnometer landed in the target, disease diagnostic chart. In fact, the diagnometer is right in the middle of the allergies area of the chart. That is 100% confirmation of my original diagnosis. Congratulations. You have absolutely nothing to be concerned about. I'm sorry, doctor. I should have never doubted you. What should I do now? Go home. Stop worrying. Take 2 aspirins and call me when you're dead. I mean, better.
I can't believe they make us wear these cheap, skimpy outfits.
Oh, they're not cheap. Dr. Hyde said they cost a patient an arm and a leg. These outfits are wino the low rent us originals. The official terms is PPEs.
PPEs? What's that?
Personal protective equipment.
These clothes aren't going to protect us from bacteria, viruses, or fungi.
Oh, Dr. Hyde's not worried about that. He thinks if we look frumpy with hazmat suits on, the patients will complain and we'll get fired.
Dr. Hyde always puts his staff first. You know that patient from Liberia. He was really sick. You wouldn't believe the mess he made before he left. Vomiting and everything else all over the floor. Everybody was exposed to all sorts of bodily fluids.
You should be glad you had your PPE on.
Dr. Hyde, I hate to interrupt you, but...
Can't you see I'm right in the middle of my daily crossword puzzle, medical research?
But Dr. Hyde...
All right. This better be important. Now, what is it?
Do you remember that patient you treated from Liberia? The one you diagnosed as having allergies?
Oh, yeah. Whatever happened to that hypochondriac?
He died a horrible death. The coroner thinks it was Ebola.
Thank God I took a total chlorine disinfection regimen immediately after I examined him. Well, you win some, you lose some. Medicine is not an exact science. I guess I'm going to have the diagnostic equipment checked. It was probably malfunctioning the day I examined him. If only he had had health insurance. I could have treated him with leeches and probably saved him.
His relatives would like to if you plan to attend the funeral. It's scheduled for this coming Saturday afternoon.
I would dearly love to, but I promised my fraternity brothers from medical school that I would go binge drinking, review best clinical practices with them and, well, a promise is a promise. I can't afford to let my medical colleagues down. They would think I am highly unprofessional. Now, nurse, you really must go. I have to get back to my crossword puzzle, medical research. I am obligated to make sure my skills are cutting edge. My patients always come first.
Of course, doctor. The reputation of this institution must be maintained at all cost.
That's why patient care is always job one, at Texas Predator Hospital.